Welcome to the body imaging cases. This is a 67-year-old male with hepatitis B on follow-up by ultrasonography for hepatocellular carcinoma who experienced right pelvic pain. This is the X-ray of the pelvis, and it shows extensive osteolytic lesions of the pubic rami. It shows also a fracture line in the right iliac bone, which is probably the reason for his right pelvic pain. And we notice here that fractures of the iliac blade may appear as lucent lines, but also as bright lines because of the overlap of the fracture edges. We see also here a missing pedicle of the lumbar vertebrae. Here are the details of the fracture. And on the frontal views of the thoracic and the lumbar spine, we see missing pedicles. For example, this one here, and this one. And as we have seen, the lower lumbar pedicle on the right. Missing pedicle is an important sign of osteolytic lesions on the frontal X-ray of the spine. And for those who are exam-oriented, this is also a very important point to be taken in consideration, particularly if you are provided with a chest X-ray that shows the spine with sufficient clarity, and there may be a missing pedicle there. Because of all these findings, MRI of the spine has been performed, and on this sagittal T1-weighted image of the spine, we see two important features. First, the lesions are having higher signal intensity than the spinal cord. We presented this sign before in case number 24 of this same series, and we said that it suggests multiple myeloma rather than metastasis. But we also mentioned that some of the metastases may have the same appearance. And I'm presenting this case today to give an example of these metastases, which may share with multiple myeloma the feature that they are higher than the signal intensity of the spinal cord on T1-weighted images. The second important observation here is the presence of high signal intensity of some of the intervertebral discs in relation to the rest on the T1-weighted images. This observation has been frequently made in patients with chronic diffuse liver disease. This is a detailed view of the observation, and at a higher level also. The reason behind this observation is not known, but it may be deposition of manganese within the intervertebral discs. Hepatocellular carcinoma is one of the mimickers of the multiple myeloma as far as the signal intensity in relation to the spinal cord is concerned, because the metastases contain hepatocytes, and the hepatocytes share with the mother hepatocytes in the liver the feature of their high signal intensity on T1-weighted images. The reason why we may think here of hepatocellular carcinoma metastasis more than multiple myeloma is the involvement of the pedicles. The heavy involvement of the pedicles is more in favor of metastasis than multiple myeloma. The second reason is the presence of hepatitis. This is the measurement of the signal intensity, showing the higher signal intensity of the lesions in relation to the spinal cord. And this is the appearance of the lesions after injection of contrast agent. The patient has been followed up by ultrasonography screening for hepatocellular carcinoma since 2017, but he was not consistent with his ultrasonography appointments. He missed 2 years, came again in 2019 for an exam which did not show hepatocellular carcinoma. And in 2020, he had this ultrasonography which was negative also as far as the hepatocellular carcinoma screening was concerned. And immediately after this ultrasonography, he had the right pelvic pain and the heavy metastasis of the bones. This is the ultrasonography done after discovery of the bone lesions, and it shows a lesion that should raise the possibility of hepatocellular carcinoma. Looking retrospectively at the exam of 2020, there is a lesion at the same location, but it has been missed because of the poor quality, but proved by CT and proved by biopsy of the vertebral lesions. There have been rib metastases and lung metastases as well. This is three-dimensional representation of the skeleton showing the metastasis and the fracture of the iliac blade. There has been also rib metastasis. And these are the metastases which were seen as loss of pedicles on the thoracic radiograph. So we are dealing here with metastatic hepatocellular carcinoma, and our learning points are: hepatocellular carcinoma metastasis to the spine is iso or hyperintense to the spinal cord on T1-weighted MRI, a feature shared by multiple myeloma, but not frequently by metastasis from other primary malignant neoplasms. Here is our case number 24 showing the multiple myeloma and the hepatocellular carcinoma metastasis that mimics the same hyperintensity. This is, on the other hand, a breast cancer metastasis and showing less signal intensity than the spinal cord. High signal intensity of the thoracic intervertebral disc occurs in patients with chronic diffuse liver disease more than in other patients, and it may be a sign that draws our attention to the possibility of chronic liver disease if this is not known clinically, and in the present scenario may favor the possibility of hepatocellular carcinoma metastasis over that of multiple myeloma. Hepatocellular carcinoma may grow and have metastasis in a clinically silent way. In fact, what caused the pain here was the pathological fracture and not the heavy metastasis of the skeleton, because metastases are everywhere, but pain happened only in the right gluteal region. Close imaging surveillance of high-risk patients for hepatocellular carcinoma is required. Ultrasonography has its limitations in early detection of hepatocellular carcinoma. Fractures of the iliac blade may appear as a dense line due to the edge overlap, and the missing pedicle sign is important for diagnosis of metastasis on X-rays of the spine.